And our next bill will be House File 1326, Representative Wogemont. And this bill will also be laid over for possible inclusion. Representative Wogemont, if you'd like to proceed and tell us about your bill.
Well, good morning, Mr. Chair and my Sherburne County neighbor, as well as members of the committee. It's great to be back in front of Labor. I really miss you guys, and I'm grateful for the time we got to spend together on the committee last biennium standing up for Minnesota's workers. I'm here today very grateful and excited to present House File 1326, which is a nonpartisan, bipartisan bill to fund the 8 Minnesota Centers for Independent Living. I'm proud and grateful that my constituents with disabilities are represented by independent lifestyles, as well as Minnesotans throughout central Minnesota, throughout the state. And I'm really grateful to have co-authors from both parties whose districts include other of the Centers for Independent Living. Mr. Chair, members, you might be asking yourselves, what are Centers for Independent Living? Well, let me tell you, they are one of the very few statutory nonprofits in the state of Minnesota. That means that we as a legislature have specifically charged them in state law to carry out the task of training, coaching, mentoring, and promoting independence, job skills, and self-determination for the countless people in our districts that may need assistance to become independent. Mr. Chair and members, there should be a handout in your packets that illustrates the duties and responsibilities that the centers have, and it'll really underscore for you what makes them so much different than other nonprofits that come before this committee. And I want to be clear, the centers have rigorous reporting requirements at both the state and federal level to ensure positive outcomes and accountability. How it works is the centers divide the funding equally, and they work to promote dignity and independence for so many people with disabilities that while we do our best to quantify it, it's actually difficult to quantify. One thing that I really want to highlight for you in that handout is that you'll see that these centers actually save taxpayer dollars. How? They do it by keeping people in their own homes and apartments and then ramp them into jobs rather than going into expensive institutions like assisted living centers and nursing homes. They help build wheelchair ramps so people can stay in their own homes. For example, Mr. Chair and members, the centers have quantified that 1,655 individuals with disabilities were relocated or otherwise moved from or prevented from entering long-term care institutions in the last budget cycle alone. To put that in perspective, the cost range for just those individuals would be a savings of $106 million to $254 million. Again, let me repeat that, a savings of $106 million to $254 million. That's either cost saved from family checkbooks and or dollars saved in medical assistance, Medicare, Minnesota counties, or other cost providers when someone enters a long-term care institution. In closing, for my opening remarks, Mr. Chair, I just want to lay out what the bill does. It provides the centers with their original base funding from the last budget cycle of $3,011,000 each year, plus the $4 million one-time dollars that were allocated each year from the last biennium to be made permanent. What will we do with those dollars? We'll provide reliable staff, job coaches, skill providers, and others that can provide for independence for our constituents with disabilities and help move them toward true job and life independence. And it will save our state even more money. This bill matches up with some federal dollars and is allocated through the vocational rehabilitation area at DEED. Mr. Chair and members, the more that we can do to prevent people from entering high-cost institutions, the more we can do to help them enter the job market, live in their own homes, it's going to be better for families, our economy, and our state budget. So, Mr. Chair, that's what the bill does. That's why I'm bringing it forward. And I have with me today two outstanding examples of success stories from different parts of the state that will share stories of how the Centers for Independent Living changed lives in miraculous ways. And Mr. Chair, with your permission, I will first turn it over to Jesse Gomez, the Director of the Metropolitan Center for Independent Living, to add to my introduction before we have our two witnesses today. Thank you.
Thank you for that. And Mr. Gomez, if you would identify yourself for the record and please proceed.
Thank you, Mr. Chair. Representative Wolgamott. I'm Jesse Bethke Gomez. I'm the Executive Director of Metropolitan Center for Independent Living, located in Minneapolis, St. Paul. I'm so excited to be here with you today to talk about our 8 centers for independent living. We have many of our 8 centers who are here today from Hibbing, Minnesota, from Marshall, Minnesota, to St. Cloud, Minnesota, are here with us today. Access North from Hibbing, Minnesota Freedom Resource Center from Moorhead, Minnesota Independent Lifestyles from Sauk Rapids, Minnesota Operations Resource Center for Independent Living from East Grand Forks, MCEL from St. Paul, Southeastern Minnesota Center for Independent Living from Rochester, our Minnesota Southwestern Center for Independent Living from Marshall, Minnesota Smiles Center for Independent Living. As Representative Wolgamott said, we are a statutory nonprofit, and we're also written into the Workforce Innovations and Opportunity Act. What does that mean? That means rigor, that means oversight, that means vocational rehabilitation services serves as our state designated entity. So we have rigor in the review of our centers. I also want to mention that we are very, very grateful to your investment for that one-time gift, and also for your investment, the one-time funds, and also our ongoing support. The Centers for Independent Living during the pandemic were there. We are essential community providers, and I'm excited to share with you some examples of your investment with our centers. Independent Lifestyles. With these funds, we're able to increase their employment program with Bright Light Creations that looks at hiring and training with people with disabilities in a competitive employment environment. I'm excited to share with you that the Center for Independent Living in Northeastern Minnesota, Access North, has done some phenomenal work strengthening their organization, being able to build more ramps, to reach more people, and to do some phenomenal things. And over their last 40th anniversary, they have served over 80,000 people in the state of Minnesota. We're very excited about what they've done, too. I want to also share with you, as an example, looking at Freedom Resource Center for Independent Living. They're stronger, they're serving more people. And then lastly, let me also say that for Metropolitan Center for Independent Living, our agencies are, by federal law, 50% of our employees must be people with disabilities. And MCIL, 65% of our employees are people with disabilities. We are a high-performance organization, and 65% of our people are people with disabilities. But your funds helped us with this. Over the last 10 years, we've seen a 300% increase in our healthcare coverage. When we went to go bid, there were healthcare firms that would not even allow us to bid. We were faced with severe crisis, severe layoffs. And I can share with you that thanks to your investment in us, we're able to find actually new healthcare coverage, lower healthcare coverage, innovative healthcare coverage, making certain that we manage that cost for the agency, manage that cost for our employees, and at the same time, we literally doubled the number of people that we have helped to contribute towards all of our centers for independent living, having over, in total, 1,655 people moving from institutional care settings and into the community. In short, your investment in our centers help us to stabilize people, help us to make certain that there's a social connectedness, and that helps us to create vibrant communities throughout all of the 87 counties and in your cities as well. And what does that mean for us? That means a sustainable economic future. So on behalf of our Centers for Independent Living, we thank you for that investment and our ability to make a difference in the lives and advance independent living for people with disabilities in so many phenomenal ways. And after that, Representative Wolgamott, I'll turn it over to our invited speakers who have some phenomenal stories to share with you as well.
And if the two testifiers, if you would like to take your turns, and please identify yourself for the record and proceed.
Okay, I can go first. My name is Carol LaFleur. I'm from Brooklyn Park, Minnesota. Committee chair and committee members, I would like to address you today because as a youth, I grew up in a household that was very abusive. The house was blown up. I ended up on the street, homeless and an addict. I engaged in a domestic violence relationship in 1990. I ended up in a hospital because I was anorexic and very sick, mentally sick and physically sick. I went through every psychiatric unit in the state of Minnesota, 2 nursing home stays, a group home stay, a stay at a Wilmer Regional Treatment Center, and the last stay was a Noco Regional Treatment Center. Now think of those dollar signs from 1990 to 1997 that you spent on me being contained in these facilities. January 1997, I called the Capitol because we were being abused at the Anoka Regional Treatment Center. State Representative Bill Haas took my call, whom I did not know. He was coming to the facility. Because he was coming, I got put in a 7-point restraint chair. I will never forget that and was told not to tell him what happened. I was released January 21st, 1997, back to my home. Mind you, from all of my disabilities, being anorexic and being mentally unstable at that time due to domestic violence, I was in a wheelchair, 15 years. I went home in a wheelchair due to the assistance of Bill Haas. I gained the case management services. However, I was assigned multiple agencies, but these agencies would send people out, but they did nothing for me. They didn't garner the fact that I had dreams, I had goals, and I had aspirations. I stayed in one room in my home. I was agoraphobic. I only went to the hospital if it was by ambulance, literally. So again, you're continuing to spend all this money, and you're not getting no return for the money you're spending, right? Eventually, I was assigned to Metropolitan Center for Independent Living. I was assigned a staff member who was well-trained, who seen me as an individual who had goals, who had dreams, who had aspirations, who wanted to do something with their future. She pushed me. She pushed me hard. We fought. I swore. She cussed. She didn't cuss. I cussed. The thing was, though, staying in the home was hard, and slowly, her and 2 other staff members who worked with me were able to take me out in the community, with what doctors could not have done. And I was able to start gaining some independence back that way. And then I seen a commercial for college, and I said, oh, I want to do that. And they took me there, but I was in a wheelchair. I went to North Hennepin Community College, started in 2005, graduated in 2011. Yes, mainly in a scooter and a wheelchair, but I did it, right? After that, I went on to law enforcement school with the assistance of my staff member from MSIL. I graduated from law enforcement school in 2014 at the top of my class speaker, summa cum laude, outstanding undergraduate. In 2015, I was hired for Metropolitan Council. I currently work for Metro Transit Police Department, have been there 10 years in May. I'm the Community Outreach Coordinator. I'm Native American Liaison, and I work on the Homeless Action Team, working with individuals with disabilities, mental illness, and addiction on our systems. So they have taken me from being that person that was a throwaway according to society and according to the state hospitals, these nursing home and group homes, to someone who's now walking, working, and paying it forward for others, right? But not only did they change my life, the thing that is, I had children when I was addicted, right? So my kids have disabilities. But because of the skills they gave me, my children are active members of society. So when you changed my trajectory, I was able to change their trajectory. And the services, when I work on the Homeless Action Team, when I'm working with these clients, I'm able to help change their trajectory. Investing in this program is the best thing we can do. This is so important to me because look at me now. I'm alive when the doctors told my family I would be dead. And I'm not. So thank you for listening to my testimony, and please support this.
And Mr. Schneider, if you'll identify yourself for the record and proceed.
Yes, sir. Good morning, Mr. Chair and committee members. My name is John Schneider. I'd like to tell you my story. I was homeless. I was living in a hunting blind. I purchased this hunting blind with the intention of outdoor activities with my son. I found myself living in it. I was eating squirrels out of the wilderness. I was doing what I can to survive. You see, I served honorably in the Marines for 10 years. I was trained as a scout sniper. When I got out, I had a hard time transitioning into a civilian life. And I look back on that now and wonder, how could I have gone from the Marine corporal that I was to, I don't want to say failing, to falling. You see, In the military, I almost want to tell you that's about the easiest job you'll ever get. Never have to make a decision. You're told what to do, when to do it, every minute of your life. So I had a really hard time transitioning into this civilian life. I didn't have these skills to live independently with that guidance or support not being there anymore. And I was struggling with my PTSD. I was struggling with epilepsy. Then one day, I get a phone call from a gentleman who said he's from a Center for Independent Living. And I had reached out to quite a few places, and I kind of was expecting to wait in a big line or maybe have a door closed in front of me again. But this gentleman simply wanted to know what my needs were, and he wanted to talk with me. He fed me. And this was about the time I was at the end of my rope. I had little faith in the system or myself any longer. My needs and issues, the first thing that we accomplished was housing. I got my own housing. I got my own apartment, along with energy assistance, some donated furnishings, kitchen items, and some cooking skills that I didn't have. I didn't learn those in the military. They give you an MRE to eat. So over time, this gentleman advocated for me, which was really, really needed. I was very nervous. I was breaking down every time I got in front of somebody. Over time, I've learned to advocate for myself, to get the medical treatment I needed, to file for Social Security disability. You see, the Marine Corps taught me the skills to save my life. But the Minnesota Center for Independent Living, they taught me the skills to live my life. The most important thing I got back was my family. My son now lives with me. My mother, once again, respects me. I, once again, respect myself. Now, I've moved on for my education. I've earned my associate's degree. I graduated with 4.0. Went further and pursued my Bachelor of Science. Graduated with 4.0 as well.
Wow.
Currently, I speak on the dangers of drugs and alcohol to the minors in the community. I moved into a house of my own, and I own my own reliable vehicle. I have the honor of leading my tribe's ceremonial traditions as the Eagle Staff Carrier. So that's me leading the entire tribe. I went from homeless to leading my people. I've also been promoted to Commander of American Legion post-2001. I consider myself a productive member of society once again. I do owe Access North a deep debt of gratitude. I had a huge mountain of issues to overcome, and the Center for Independent Living broke that overwhelming mountain down into small, manageable steps that I can achieve. In closing, I ask you to please support our legislative request to continue to fund the previous $8 million appropriation for the Mace Hill, the 8 centers for independent living, and add this permanently to the base funding. I want to thank this committee and the Center for Independent Living for being here today. Thank you.
That was quite a story. Do we have any member questions? Lead Pinto?
Thank you, Chair. Looking to see if anybody else does. Yeah, I totally agreed about the testifiers. Was there another member that was going to say something? I wasn't sure. Okay. Appreciate to both of you just such powerful stories. Mr. Schneider, thank you for your service to our country. And to both of you, just really inspiring to have you share that with us. I had one question that maybe I had an exchange with our phenomenal fiscal analyst, Ms. Ang, to just talk about, just remind me if you can, or clarify what the current base funding is for the coming biennium for the Center for Independent Living, just as we're thinking through our budgets, if you can.
Mr. Chair and Representative Pinto, the base budget is $6 million for the fiscal year 26-27 biennium.
Okay, thank you.
Mr. Pinto, Representative Pinto.
Thank you, Mr. Chair. Okay, that's helpful. And so 6 million over the biennium, this would be going to 14 million. And then my understanding is that that's sort of matching the amount that had been received this in one-time funding. So trying to just make sure there's not a cut from last biennium to this one. Okay, good. Getting a thumbs up from Representative Wolgamott. That's great. And then maybe just I'll direct the attention of members then. Although these are nonprofits, this is, I think, a great example of a grant program that is sort of established. If you look at the statute that we've been given, it's established, I think, partly under federal law, but these organizations apply for funds. There's sort of different oversight than there is if we sort of named individual nonprofits. And so I think this is a great example of a grant program that is kind of overseen in a different way than just we sort of identify a particular organization, the money goes to it. Instead, this has been set up as a structure and one that it sure sounds like is working really, really well. So Representative Wolgamott, thanks for bringing it forward, and to all of you for your work. Thank you, Chair.
Thank you. Representative Mueller. No further questions from members. Representative Wolgamott.
Well, thank you again, Chair Meckland and members of the committee for the opportunity to present House File 1326. In closing, I first really want to thank our testifiers today for your powerful story. We are so impressed by your courage in the success in your journey, and you sharing that story with us today will be an inspiration for countless here for us at the legislature and countless Minnesotans throughout the state. So thank you. Thank you. Thank you. Mr. Chair and members, you've heard it from these testifiers. You can see in your handout the success that Centers for Independent Living has had in having the backs of all of our constituents from all abilities, from all walks of life. The success that they've had and the cost savings to our state is off the charts. And I urge you, as you're putting together your budget, this is such a good investment for the people of our state, for our budget. And I ask you with all my heart to include this appropriation for the Centers for Independent Living. Thank you, Mr. Chair. Thank you, members, for your consideration.
Thank you. And again, members, this bill will be laid over for possible inclusion.